Bud Light Beer, Anheuser-Busch, St. Louis, Missouri.
Ocala's information station, 1370 WOCA.
Ocala!
All right, 24 minutes before 10 o'clock. Thank you for tuning in this Friday morning. You know, one of the things that always surfaces whenever there are high-profile candidates in the news is that one or another candidate, celebrity, whoever, they will say something that has to do with a field they're not really familiar with. I mean, if you're an actor, you know acting. If you're a businessman, you know business. You don't necessarily know about cancer. You don't necessarily know about autism, et cetera, et cetera. But still, the public at large will hear what somebody has to say, and they say these things with such certainty that then the doctors have to all clamor and say, well, wait a minute, let's go on a radio tour or something and kind of dispel the myths. And there is one that is about to be dispelled right now. I don't know anything about BRCA. I think it's actually pronounced BRCA. I could be wrong about that. On the phone is Dr. Richard T. Penson. He's the clinical director of medical gynecologic oncology at Massachusetts General Hospital and the associate professor of medicine at Harvard Medical School. And Lisa Schlager is on. She is a survivor of BRCA1 gene mutation and an advocate for National Hereditary Breast and Ovarian Cancer Week and National Pre-Vivor Day. So what it says, Pre-Vivor Day. Let's say good morning to our two guests, Dr. Penson and Lisa. Good morning to both of you.
Good morning to you, Larry.
Good morning. Thanks for having us.
Oh, you're welcome. Where are you both?
I'm based in the Washington, D.C. area.
Okay.
And I'm in Boston.
Okay. Well, thank you for being on the air with us. So help me understand. I guess we need to know what this is first, and then what is the misinformation that has been getting out there?
So, Larry, you are right on the money with pronunciation. It is BRCA, and just with the scientific nomenclature, that's supposed to be italicized if it's a gene, and just normal capital letters if it's a protein. So genes are our blueprint, and they make key proteins, all of the structure and function of cells. And what a lot of people call BRCA, you can call it BRCA or BRCA, is a key DNA repair gene. So it's a sort of policeman of our DNA. Every day we have multiple tens of thousands of mutations that happen, and this is one of the key controllers of regulating that it's right. So if a mutation happens, it stops, checks, repairs, or sort of suicides and gets rid of any cells that have mutations in it. So that DNA repair is key, and if it's got a mutation, if you've inherited a mutation from a parent, then you're at risk of cancer. And for this gene, it's breast and ovarian cancer. BRCA2 is breast, ovarian, prostate, and pancreatic cancer. And we are on the road, as you said, to make sure that people are more aware that they can be doing something about it. There was for a long time a concern that ovarian cancer was a killer. I don't want to know about it. Now we want people to know so that members of families, when there's a family history, a BRCA gene mutation is discovered, the other members of the family who carry the at-risk gene can be proactive, like Angelina Jolie or like Lisa.
So,
Correct, yes.
So can it be passed on by, okay, if it's breast cancer, can the father pass it on even though he's a male?
Absolutely.
Yeah, that's correct.
I inherited my BRCA1 mutation from my father.
Oh, really?
Yes, and obviously he's not getting ovarian cancer,
right.
And most men don't get breast cancer, but he carried that mutation and passed it on to me.
And how did you find that out? Did he have to get tested?
He did have testing, yes, as a result of his sister testing positive for the mutation.
Okay.
He was tested, and then I was tested.
When a woman goes for her physical examination, does she have to ask for a BRCA testing, or is that given automatically?
Oh, no. So I'm sure the doctor could explain more, but just in general, a healthy woman, a woman that doesn't have cancer, wouldn't necessarily be a candidate for testing unless there is a certain amount of family history of cancer.
Oh.
So that might be early onset breast cancer in the family, ovarian cancer in the family, and the doctors should take a good medical history, a family history, to know if a woman might be at risk for one of these gene mutations, and then refer her for genetic counseling and testing potentially. A woman with ovarian cancer, however, every single woman who has ovarian cancer is a candidate for genetic testing because a high percentage, about 25% of ovarian cancers, are due to an inherited genetic predisposition. So that's very important that any woman with ovarian cancer should ask for genetic testing. It can help dictate what her treatment is and also her risk for other types of cancer. But a healthy woman would only, or man, would only need testing if they, at least at this point, if they have family history indicative of a hereditary cancer syndrome.
So do you do anything different, doctor, if the testing proves positive?
Yeah, so it turns out that it's a curse that causes more cancer in their families. But if you have it, you have a slightly better prognosis. You can't repair the DNA when it's damaged by the chemotherapy. People get a better outcome from chemotherapy. The new drug approved last December, olaparib, has raised the expectations of patients. Now, from third-line treatment, you can get an oral treatment targeted at what goes wrong when this mutation is present, and with much better outcomes. It's about twice as good as chemotherapy, and is really part of this whole new change. Now we're looking at activating the immune system and targeted oral therapies for cancer, which is really exciting. It's win-win, less toxic, and more effective than traditional treatments.
Lisa, I struggled with the word. I struggled with the word Previvor, and I'm apologizing too. We're talking over, but that I don't think that's our fault or yours. I think it's there's a delay or something in the call. So, but the word Previvor, does it mean you survived something because you nipped it in the bud before it happened? Is that what Previvor is?
Many people view it that way. I guess our official definition is it's a person who is very high risk, who may carry one of these mutations, but hasn't yet had cancer. So you're basically pre-surviving the cancer. And as you mentioned, many women, like Angelina Jolie, like myself, have gone forward with prophylactic surgeries because ovarian cancer is so difficult to detect. If a woman learns that she carries one of these mutations, the advice and the guidelines dictate that we remove our ovaries and fallopian tubes once we're done having children, typically between the ages of 35 and 40. Some women do it later, but that is really the best solution that we have right now to preventing ovarian cancer. So I am a previvor. I was fortunate enough to learn about my mutation before I got cancer and was able to take proactive steps with my health to try to reduce my risk.
Well, it sounds scary, but if you think about the bigger picture, it's a life-saving scary.
Absolutely. Information is power.
We have such a short interview with you. I want our listeners to be able to get the information they need to look into this further. Can one of you direct our listeners to maybe a website or a book?
Doctor, I don't know who you typically refer people to, but I work with...
Tell them about FORCE. That would be fine.
Yes, thank you. I work with a nonprofit organization that supports families affected by these hereditary cancers and has lots of information. It's called FORCE, or Facing Our Risk of Cancer Empowered. It's www.facingourrisk.org. And we have a helpline and support groups and all kinds of information where people can learn more.
Okay, good information. Doctor, real quick, maybe this is a generic question, but are all cancers mutations?
Yeah, essentially, cancers are a sort of crisis aging. Through our lives, we age. It's part of being a complex mammal. The aging means that we're less good at catching these mutations, repairing them. And mutations essentially is what creates cancer. There's two main types of mutations, what are called oncogenes that drive growth, how you think of cancer as an overgrowth, and what's called tumor suppressor genes that keep you from getting cancer. The BRCA, the BRCA gene, is a tumor suppressor gene. So a mutation in that knocks out something that was keeping you healthy.
Wow. It's amazing what you can learn in a tiny bit of time. Let's see how much of this I retain, though. I think that...
Quiz next week.
Yeah. The important part is that the listeners have a way to get more information, so I appreciate the website, Lisa. Dr. and Lisa, thank you both for being on the air with us this morning.
We appreciate your investment in information.
All right. And for the listeners, we did record this. You'll be able to share this with other people. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. A flood watch is in effect for coastal counties through this evening. There'll be drenching showers and thunderstorms mainly in the afternoon today. Otherwise, variably cloudy, high of 83 to 86. Still thunderstorm this evening. Otherwise, some clouds with a low of 71 to 73. Tomorrow, partly sunny with a stray thunderstorm, a high of 86 to 88. Thunder shower mainly near the coast Sunday. Otherwise, partly sunny, high 88 to 91. From the Florida Weather